Every day, professionals in health and science strive to make groundbreaking discoveries, make better decisions, and deliver better care. And we help them do it by empowering people with knowledge. But it isn't easy. There are always obstacles to overcome. One of Elsevier's boldest risks as a company was publishing Jewish German scholars exiled by the Nazi regime. Scientific progress was being crushed by prejudice, and director Ted Klautz believed history would judge him harshly if he didn't help these refugees get heard. Risking imprisonment or worse, Elsevier published English translations of their vital work. It was a brave, innovative decision and ensured that groundbreaking knowledge reached a global audience. Today, we still believe we must make brave decisions. That's why we pioneer cutting-edge technology to support the international science and medical community. The volume of research has grown exponentially since the 50s, and we have continuously improved the management of information and data. We were the world's first publisher to create and house a database, explored inventive new ways to deliver journals to scientists electronically. And before people had even heard of the World Wide Web, we created a revolutionary pilot to send articles via online connections. Each advancement was a bold step towards the launch of our first commercially available online platform. We are a global information and analytics company, #1 in global science, technology, and health publishing, working with almost every top US health system, as well as leading systems around the world. We are digital and lead the way in big data and information analytics expertise. In everything we do, we'll never stop striving to help expand the boundaries of understanding for the benefit of humanity.
Good afternoon, good morning, wherever you are. Welcome to CLAC 2021, the Latin American and Caribbean Open Science Forum, a premier forum on science, technology, and innovation for sustainable development in the Latin American Caribbean region. CLAC 2021 is taking place virtually this year, with some face-to-face activities from the autonomous city of Buenos Aires in Argentina. My name is Amandeep Gill. I'm the moderator of this panel. I run the International Digital Health and AI Research Collaborative in Geneva. This initiative is based in Geneva, as I mentioned, but has a growing network of regional hubs in places such as Singapore, Nairobi, New Delhi, Tunis, and Santiago, and hopefully soon in South Africa, in Senegal, and in Canada. We are a new global platform for harnessing the digital transformation for universal health coverage, and our mission is the collaborative research and development of digital technologies with a focus on networks, needs, and opportunities in low-income and lower middle-income countries. I'm joined today by a stellar panel to discuss an important and urgent theme, building health systems resilience through digital public goods and science commons. This is a theme that sits well with CLAC's focus this year on achieving the Sustainable Development Goals through science, technology, and innovation in the face of a new normal created by the COVID-19 pandemic. Please join me in welcoming our panelists. First, former Minister Janet Vega Morales from Santiago, Chile. She's currently Senior Advisor to the CEO of UC Christus Health Network. And then we have Ms. Constanza Gomez Mont from C-Minds, originally from Mexico City. C-Minds, and she'll explain more about it, is a think and do tank in the area of technology, society, and impact. And then we have Professor Marwala, who's president of the University of Johannesburg in South Africa and deputy chairman of the South African President's Commission on the Fourth Industrial Revolution. Welcome to each and every one of you. I'm truly delighted to have you with me to explore the questions for this theme. Perhaps I can turn to you first, Professor Marwala, and ask you to briefly present yourself and look at these questions from the South African perspectives. You've done this 360-degree survey of fourth industrial revolution technologies from the perspective of a large developing country. You have a PhD in artificial intelligence. If you can tell us about the thinking and the experience in South Africa about leveraging data and artificial intelligence for public good. So.
No. Thank you very much for the invitation. I am quite excited to be speaking today. I have been working in the area of artificial intelligence for the last 25 years. And I'm excited about the recent developments where AI is now being used to solve our problems. So, of course, the fourth industrial revolution, which is something that I'm working with the president of South Africa, is about, is broader than just artificial intelligence. It includes things such as biotechnology. It includes other areas such as blockchain, which are quite independent of artificial intelligence. But it is quite clear that artificial intelligence is probably the technology that is going to transform our lives, our health, more than all these other technologies. So what are some of the challenges we are facing in South Africa in this regard? I think one of the first challenges that we are trying to entangle is the issue of skills. Now, given the fact that AI technology is able to do things that doctors do sometimes better than doctors, how do we train doctors? Of course, the doctors must actually be able to understand technology now more than ever before. And then there is the issue of data, because without data, there is no AI, certainly not the one that is based on a multi-layer perceptron. Maybe the fuzzy system can work with limited data. But much of the dominant version of AI require data. Somebody once said data is the new oil. Now, I think the challenge that we are facing in South Africa is, how do you avail but secure data? For example, we have huge database on X-ray images collected from all our public hospitals. And now, how do we make it available to the innovators so that they can be able to build those medical applications? But of course, we have to secure the data. It has to be anonymized so that we can protect people's privacy. How do we incentivize these small and medium enterprises to go down the path of developing these technologies? Because one thing that we have realized is that when you import technology that is trained with data that is not local, then it does not work as effectively as technology that was trained using local data. How about the infrastructure? The storage of the data infrastructure, the computing infrastructure. Of course, now we have cloud computing that is the burden of computing in order for us to be able to implement this. But all these things that I've talked about have to be regulated. It can't be free for all. Now, how do we retrain our lawmakers to be able to build laws that are going to protect our people? Because one of the problems that we face in South Africa is the scientific and technological literacy of our politicians. So how do we teach them about AI? And here at the University of Johannesburg, we have a course on AI specifically designed for our lawmakers so that they can be able to implement policies that are going to protect our people, but that are going to stimulate innovation in the health sector. Thank you.
Thank you very much, Professor Marwala. Those critical questions of capacity development, literacy around these technologies, also infrastructures, and then, of course, data and its governance. Thank you for diving us straight into those critical areas. Let me turn to you now, Jeanette. You have worked a long time in the WHO, in the public health system in Chile at the national level. You've looked at the social determinants of health, and you've been a pioneer in looking at the use of digital technologies, mobile technologies, and newer versions of digital technologies from a policy, from an enabling perspective. Now, in your current role as a commissioner of the Lancet Financial Times Commission on growing up in a digital world, looking at these trends from the perspective of a younger generation, what is your sense, and particularly from where you sit now in Chile? We see the devastation from the COVID-19 pandemic in many parts of the world. In Europe, in Latin America, in Southern Asia, the situation has, in the United States, the situation has been dramatic often. Do you think these technologies have made difference, or they are perceived in a different way post the pandemic?
Thank you, Amandeep, and I'm very happy to be here today. Thank you very much for inviting me. I do think that there are several issues to discuss, and I think that we have learned a lot from the pandemic. Probably the most important thing from my point of view is that we have learned that health, or the health sector, is not very different from other sectors in terms of the use of technology. Before, we were extremely slow in introducing some of these technologies into sort of the healthcare area. And what the pandemic has shown us is that we can go and leapfrog and be able to very fast introduce technologies to our care. So I think that's sort of a very good thing, it's an advantage. The second thing that we have learned is that there is a divide right now, that the world is divided into the digital citizens that are the younger and the more analogic citizens. And that we are rapidly getting into a world that is going to be digital, and meaning that it's not only that the technologies are there, it's that the way to understand the world is completely different. So if we want to provide services, we need to understand and then provide the services in a way that the digital citizens understand. Let me provide you with an example. For example, if we introduce gaming into the healthcare with younger generation, we are much more likely to succeed, because they are, from the beginning of their life, they are very accustomed to play in the computer, to get rewards for things that they do, and so on. So I think that we need to introduce gaming and using the games into health. So that's one thing in terms of how do we connect with the new citizen. But then the other thing, on the other hand, that we have learned is that at the same time that we are having these huge advances in the world, there are structural things that we are not ready yet. And I would say that the most important ones are two. First of all, connectivity. I think that connectivity is crucial. One of the problems we have is that we don't really have rural connectivity in everywhere and across countries. And if we want to use technology for education, for health, for whatever, we need to have our people connected. So I think that that's one of the things that we have learned over the course of the epidemic. And then the other thing we have learned that is connected to that, but a bit different, is that we need to have systems that can talk to each other, meaning interoperability. If we have systems, even if we have a lot of technology, but they don't talk to each other, they don't connect to each other, there is no way we can basically trace the individuals and trace what is going on with them. So I would say that we have a long way to go in Latin America, but the pandemic, with all its devastation, has let us understand better how to introduce technology and how to introduce more advanced thinking, such as beginning to use artificial intelligence for basically some of the processes that can be done in a much more robust way and automatically. Over.
Thank you very much, Janet, for bringing in those themes of connecting with the young, connectivity, interoperability. and some of the challenges around being more inclusive in our approaches to technology in the health space. So this brings me to you, Constanza. If you could tell us a little more about your work in C-Minds and also offer us your thoughts on the governance side. You know, both Professor Marvala and Minister Morales have gone into that. But from your perspective, particularly from the regulatory perspective, as these technologies evolve fast, as their use cases and the business models around them mutate all the time, how can we keep up to date with our governance responses and earn the trust of our citizens as we deploy them for different areas such as health?
Thank you, Amandeep. Of course, actually, you touched a subject which we're very passionate in C-Minds, the organization I founded 12 years ago already, that is trust. So definitely, and regarding your last question on what happened, with the COVID and what's happening now, especially in Latin America, I think there's a data from WEF that we accelerated the use of digital infrastructure and digital technologies that was going to happen in the next 5 to 8 years. We accelerated in at least 5 to 6 months. So what does that mean really when such a fragile ecosystem just adopts, technologies without necessarily thinking about also how to mitigate the negative consequences of these new technologies? So just as an example, one of the quick responses we needed for COVID was using tracing technologies. But as we realized as an ecosystem, having adopted so fast these technologies without necessarily having the foundations of privacy for data, of explainability, of transparency of these systems, there was a mismatch between the social urgency to solve pressing social issues such as the health one we are living, and on the other hand, answering the question on how can we do this not being disassociated with the trust factor, with the human rights factor, with the fact that we need to ensure that whatever tools we're using, in this case, artificial intelligence and other type of tools, it's not one or the other. We're not losing our fundamental rights in this equation and in this accelerated path toward the digitalization. So what we do in C-Minds is exactly this, and these types of questions on how can we help institutions, especially the government and multilateral institutions, navigate the world of new technologies, society, and the environment. And one of my areas of interest right now as an organization and as a think and action tank are the policy prototypes. One of the questions you said, and how can we keep up? How can policy and governance keep up with such an accelerated way of adoption of new technologies? Well, one of the ways we're finding fascinating answers to this challenge of how governments can keep up with these agile and flexible governance structures for AI is through policy prototypes, especially right now in Mexico, for transparency and explainability of AI systems. So basically, in a very short summary, the policy prototypes, what we're doing is trying the policy and the future possible regulations or the future possible protocols in a very controlled way. Actually, we're testing it with 14 startups and companies that already have AI systems within from all sectors, all disciplines, and all sizes to be quite agnostic of what type of AI applications this sector is using. And what we're doing is we're testing a state-of-the-art protocol of explainability and transparency of AI systems together with the industry, together with the government, the regulatory bodies, the Inter-American Development Bank, to understand together as an ecosystem how best to regulate this area, which we are all learning from a very beginning of how is best to create these protocols. So these type of flexible and short and control experiences that we're living in a multidisciplinary way and bringing actors from all sectors to discover these answers to the pressing questions we have on how to govern these new models of technologies are throwing results that what I love about this is that the regulation is going hand by hand with the experience of the end users, which in this end is the startups or the companies. Not only that, this exercise will go all throughout the year, which Mexico will provide a formal protocol for this area at the end of this year. But this formal protocol will already have been tested with the community, which I think is a new model of policy creation, and which I hope we can adopt these types of testings for policies more throughout Latin America. Other countries such as Uruguay, for example, have very advanced policies for regulations on AI as well as systems, which also incurred in a very agile and test-like philosophy on how to go hand in hand with the industry for the development of these regulations. And apart from the policy protocols and the policy prototypes, what we also do in C-Minds is help, for example, the education institutions navigate. What did it mean from one day to the other to adopt entirely digital infrastructures to keep giving education to the students? So what does it mean in terms of privacy? What does it mean in terms of security? Because at the end of the day, having all the kids that are underage being vulnerable with their data, with their information in these new digital technologies also brings a huge responsibility both to the government and the education system and the parents and the own students to understand both the opportunities of digital technologies, but also the risks and how to mitigate better the risks. So just for example, we're doing both policy recommendations and booklets and guides for these types of environments and ecosystems as an example of other types of work we do in the area.
Thank you so much, Constanza. And we've heard perspectives, wonderful perspectives from Latin America, from Africa. And I'm glad that Anurag is able to join us to bring in a perspective from Asia. Anurag, welcome. I know you're busy with the COVID-19 emergency response in India. So very grateful to you for having found the time to join this panel. Maybe if you can introduce yourself and your work briefly at the Institute of Genomics and Integrative Biology that you lead, and also as co-chair of the Lancet FT Commission on Digital Health. And tell us a little more about the perspective from India, where there has been this tradition of using digital public goods to flatten the opportunity landscape, be more inclusive, and enable researchers, entrepreneurs, and others to work with technologies for the greater public good. Anurag, please.
Thank you very much, Aman, and my apologies for being late. It is a bit of a challenging time in Delhi right now, but I think it's also a good example I'll be able to provide you in how investing in digital public goods is now able to give us some rapid answers, even in the middle of a pandemic, when classical ways are not possible. About myself, I am the director of the CSIR Institute of Genomics and Integrative Biology. We do, as you can imagine, genomics. We are one of the main sites for the sequencing of the SARS-CoV-2 virus in India. By background, I'm a respiratory physician and a critical care doctor at one point in my life, so very familiar with the type of illness we are seeing right now. I work as a co-chair along with Ilona Kickbush for the Digital Health Futures Lancet Commission, growing up in a digital world, looking at how children will be affected in this world that we are creating. Coming back to today, coming back to the importance of digital public goods, and coming back to the importance of a foundation that you can build on to get quick answers in a system that may not be ideal. I want to start, Aman, with highlighting a very important problem that we have been facing in the last 2 weeks. Our city, Delhi, had a seropositivity of 50%. We were expecting the outbreak to be not as high as we are seeing right now, because in January, we had 50% seropositivity. So clearly, if you are seeing a huge amount of cases in the middle of a city that had high seropositivity, you have to ask yourself, what is happening? Are you looking at immune escapes? Are you looking at vaccine escapes? But to answer those questions properly, either you have to be like UK, The UK sequences 6 to 10%. The UK has the NHS. The UK has electronic health record data on every patient that passes through it. We don't. But we have something else from which we built our foundations. We have a national universal digital ID. We have the capacity when we create any pro forma. So every time you get a PCR test done in India, there will be a common digital form tagged into your phone that people will be filling out, getting a code. The minute the test is done, the results of the test will be uploaded to a central server in the country, which basically means that while we may not be able to culture or do pseudovirus in 7 days flat, we can do simple things. We can see who got vaccinated. We can see how many doses they had. We can see whether the RT-PCR test is positive and related to their data. We can ask simple questions like between various vaccines, which one is having a higher breakthrough rate? We can ask very simple questions between different parts. What are the immediate test positivity rates? We can correlate with other factors. We can use it to guide the response. It is very hard for me to tell you in the middle of a city struggling with even oxygen to say we are doing a great job. But what I can tell you is that given the limitations of a megacity, almost brought to its knees under an onslaught of this virus, with lots of escape mutants, we are seeing a huge amount of B117, the UK strain. Again, we are sequencing continuously side by side to understand the picture. So again, a investment in digital health beyond, the notion of digital health. I would say genomics is as much digital health as anything else. And being able to share information rapidly between 10 sequencing labs in India, bringing in samples, shipping them throughout, building portals, a little bit later than I would have liked, I will say that right now. But the nucleus and the foundation was built by years of investments into public goods. And here I will take digital public goods in a very larger sense of the word. A universal digital ID, a universal payment system, attraction of businesses towards a digital way of doing things, creating virtually networked centers across the country that can operate together seamlessly, a national knowledge network that connects every single educational higher institution of India so that I can transfer even large genomic run files from one institution to another without having to go to the internet, so as to say. So these were small investments that a country made, not a very rich country, but that allow us to perhaps punch a little bit above our otherwise weight as an LMIC. And if I were to give one message today in my learning, we can never never neglect physical health infrastructure. That's where we are suffering. But on the same time, given whatever physical health infrastructure you have, by building digital public goods and foundations, you can use it a bit better than you would be able to otherwise. I hope that I was able to illustrate one point, Aman, that I thought I would make today in today's discussion.
Thank you so much, Anurag. You've done that, as always, very eloquently. Thank you so much. And in a sense, it ties back to a point that Dean Marwala was making about don't look at AI as just AI, look at the larger constellation of technologies. And digital is, in a sense, stitching different domains together, bringing them together. You mentioned molecular science and genomics, and the importance of bringing researchers, information, entrepreneurs together through these networks. Professor Marwala, I want to go back to that thought and talk a little bit about the collaborative use. Anurag talked about it, and you mentioned it in the context of the 4th IR commission that you were deputy chairman of. So how does the LMIC's landscape create these new opportunities for researchers and scientists using digital public goods, using data as a kind of thread to pull different domains together and accelerate the economic transformation, the social transformation at home?
No, absolutely. I think collaboration is absolutely very, very important. And one of the things that we have identified, certainly in South Africa, is that the issue of cross-validating data, building a model to solve the same problem using the data that has been generated in South Africa, and testing the model using the data that has been generated in India, for example, actually does bring some interesting algorithms and architecture when you are designing these AI systems. So now, for us to be able to do that, there has to be country-to-country collaboration. We have to put some of our database on an open platform where we can be able to share a database. Now, of course, if some of the database involves commercial entities, there might be issues of IP that we have to worry about, but those are issues that needs to be handled. And then there is also the issue, of course, with COVID, there's not much movement of people from one place to another, but movement of people from one country to another for the benefit of co-creating this infrastructure is very important. Of course, here in South Africa, we're lucky that South Africa has a fairly developed infrastructure for collaboration. For example, we have South Africa-India joint research collaboration framework, where researchers from the two countries jointly apply to their respective funding agencies. And for that grant to be successful, both parties must win. And this framework is replicated across the board with South American countries such as Brazil and so on and so forth. And that obviously assists in movement of skills, And then the other issue is obviously the collaboration between researchers and industry. And that is a complicated relationship. Medical companies, how do they work with public research organizations so that we can create something, platforms and algorithms and products that are actually going to work for all the people. And then there's the issue of testing, because here in South Africa, we always say South Africa has two economies, first and third. And then you realize that we develop algorithms in the city sometimes using data from the city, but the real need for these devices is actually in the rural area where you don't have doctors. Again, the need to have a common platform, collaborative platform, cannot be emphasized enough. Thank you very much.
Thank you, Professor Marwala. Janet, this notion of collaboration across borders, open science is the mantra here at CILAC. So there seems to be some kind of breakdown of multilateralism, and you've been in the WHO and other multilateral reflections. So what is it that we can do to reinvent cross-border collaboration, have these open platforms for science making together, knowledge making together, and bringing in more focus on the researchers from the emerging geographies of innovation? If you could unmute yourself, Janet, please.
Okay, yes, thank you. I was saying that it is more than open science. It is also open institutions, right? Because it's very important that the institutions around the world are able to put their data into a format that we are all able to get those data. I do think that perhaps in this particular area, the way to collaborate is throughout common goals. For example, I think that the pandemic has brought a lot of collaboration, for example, for the genomic sequencing and genomic surveillance, Also for some of the data that are being shared. You see our World in Data, which is this platform, this global platform that is basically provided information to all the countries in the world on what is happening across the country. And the beauty of that is that it's almost real time. But in order to do that, you need to have a common goal. In this case, we have a very clear common goal, which is basically to get over this pandemic. And we know that we are all in this together, and that if the only way to save each one of us is that we all be saved from the pandemic. And that is the complication, because most of the times, unless there is one phenomenon that affects the whole world, that collaboration does not necessarily happen. And you see that every day in science, that basically you have a very vertical way of dealing with science, where people providing the data are usually from least developed countries, and people publishing are those that are from developed countries. So for me, the issues are not related to technology. The issues are much more related to power and use of means like publications to advance careers or advance specific countries' agendas and so on. So I think that is the real issue here. And we need to come up with ways of sorting those. Because, for example, we know that data is the new oil, but we also know that data are becoming an increasingly powerful source of inequitable societies and an inequitable world. So the question for me is, how are we going to make sure that this huge advance in data, artificial intelligence, and so on, in fact, everybody in the world can take advantage of that, or every country in the world can take advantage of that? And these are fundamental questions that we do not have answers. Some of the answers probably rely on proper regulation, but the problem is that the industry and also some specific corporations are way ahead of the curve on that. And now we need to basically figure out, how do we regulate, how do we control, how do we make sure that we achieve equitable access and so forth. Over.
Thank you, Jeanette. I think the idea of leaving no one behind in the SDGs, whether it is countries, communities, or individuals, that came out very strongly in your statement. And how do we make sure that, just as we see, Constanza, I'm looking at you, so just as we see in terms of digital consumerism, so the content is developed in one place and the other side just consumes it, how do we, in science and in governance, make sure that there is more equitable participation, that knowledge making is done more inclusively? What are your thoughts on that?
In my world that I work a lot with startups ecosystem and the innovation ecosystem, one of the biggest challenges we're facing is, how do we make this ecosystem competitive when we have the big tech, right? How do we make the data decentralized? How do we empower a sector that brings so much innovation, so much mobility, so much social, in a sense, energy into cities, into countries, into a very competitive field, not only nationally and regionally, but also internationally. So one of the perspectives is also, and going back to one of your questions on what is the role of governance and government in this equation, we're seeing more and more the public and private collaborations, where we can see that these collaborations bring a strength, both in the sharing of knowledge, in the sharing of data, in the sharing of innovation, and creating more open and innovative ways of learning through case studies and through specific use cases, how this ecosystem can be strengthened to solve as well specific challenges. And on the other side of the equation, it's the question of how do we empower people to manage their own data, for example, and to be the owners and the ones that decide to what company or to what system or to what institution they give their data. We will not have a lot of time to go into these deeply, but the question also arises if it's possible to start creating as well digital economies with this data as a other source of income for these people. So one, decentralizing information. Two, decentralizing data, like avoiding the data monopolies that we've been seeing that are growing so much, especially in regions in the global south as well. And also empowering people. How can we empower with a focus on the global south, with a focus on gender? That is also a really big aspect to this question, to be able to work in these innovation ecosystems. I do not necessarily believe in adopting whatever best practices there are from other countries. Rather, the question is, how can we empower and create the frameworks and the infrastructure for local innovation to thrive? And I believe that for these ecosystems to thrive, we need a better public and private collaborations, more open data collectives in a way, and in a sense, a direct investment in the startup ecosystem to be able to be competitive.
Great. So excellent. We have about 5 minutes left for this panel. So maybe we can try and bring some concluding thoughts to this topic. And Anurag, perhaps you can start us off and tell us, I mean, you brought this example from India, very powerful, evocative example, that with less resources, with great challenges, you can still use digital technologies innovatively to punch above your weight, make a difference. So how can we do that internationally? Can we create a more level playing field internationally in digital, in health, by using platforms? Janet mentioned that kind of innovation, more innovatively, out-of-box thinking, etc.
I think I will exactly go where Janet was pointing us to, which is basically that there are lots of power disequilibriums, and innovative out-of-box thinking is required to correct them, particularly in the world of data. Information flow, information access is essentially power. There was a very nice example being done where people generating the data may keep generating it, the people publishing it might be completely somewhere else. So how do you innovate a workflow that gives equal sharing of rights to everybody? We once worked on a platform called Open Source.Discovery a long time ago, OSTD. And the idea was microcredit attribution, clear understanding of all partners from day one regarding what would be their roles, how would credit be given, and what would be the sharing of the outcomes. I think these discussions are sometimes not done because people are hesitant to do it. But I think it is time to realize that some of the most populous nations, some of the biggest markets in the world, some of the biggest data generators are also some of the biggest consumers. If we understand that data should be shared in the right spirit, there are ways in which, for example, look at just sequencing right now going on. You know and I know that with the millions of infected people, one of the hotspots, I mean, I don't know how my colleagues will think about it, the more infected people you have, the more variants you would generate, which basically means it's in global interest for India to sequence, share, use AI to make predictions, for everybody to share all tools, whether information or actual physical things with each other. And there must be absolute clarity on the crediting, otherwise you will never get cooperation. So I think every point that has been made by the speakers before me is extremely valid. And I think rapid, equitable sharing of information remains central. And for countries like ours, creating a network where at least we can generate our own information at pace is critical to standing in with the big leagues.
Thank you so much for those concluding thoughts. And it's been a fantastic discussion. I'm afraid we're running out of time. So I will not even attempt to summarize it, but we've looked at this problem from all perspectives: international organizations, national governments, research and academia, private sector, startups, and civil society, and dived into all aspects from digital public goods to governance to equity. And I think the message that comes out is of collaboration, of innovative platforms to drive those collaborations, and collective knowledge making for the global public good. Thank you once again to each and every one of our panelists. All the very best with the fantastic work that you're doing.
Thank you very much.
Thank you very much.
Thank you all. Goodbye.
Goodbye.